the manifestation of hair loss in males is androgen derived. The most effective way to stop hair loss in its tracks is inhibiting androgens. You take a male and you castrate them, you will see a cessation of hair loss. Some people might say, just shave it, bro, be confident. Jason Statham, The Rock, Bruce Willis. Hair loss is going to affect almost everyone. Listening to this, that's a male. Proactive approach is the way to go. What's up, guys? Derek, moreplatesmoredates.com. I am the co-founder of Marek Health, and I'm here today with Steven Granzella, our Director of Marketing at Marek Health, to discuss hair loss prevention, treatments, side effect management, and if you are a good or bad candidate for therapy, and what you need to know.
So at Marek Health, we have a hair loss panel. What exactly does that mean, and why is that necessary compared to a normal lab panel?
It was designed mainly to address the main hormone systems that are involved in hair loss and the progression of it, and assessing if you are not just a good candidate for intervention, but also your likelihood of encountering side effects during the perpetual use of that treatment. Because unfortunately, androgenic alopecia, as implied in the name, androgen, it is dictated by androgens ultimately, all but there's a variety of downstream consequences of the activity of those androgens. Ultimately, the manifestation of hair loss in males is androgen derived. And this is why, in general, men have hair loss almost across the board. As they get older, it's like pretty unlikely that you won't be affected in some capacity, whereas with women, it is far less prevalent. Now, they have their own issues with hair loss, but it is not necessarily dictated entirely by androgens, and it's more in postmenopause. Now, with men, the most effective way to stop hair loss in its tracks, as you would probably infer by me talking about, okay, well, what's the difference between men and women here, and what is the main thing that's determining hair loss? Androgens. What is like the logical conclusion as to what would stop it? Unfortunately, it is inhibiting androgens. So if you take a male and you castrate them, or you have them transition from male to female, you will see a cessation of hair loss. And there's a reason why eunuchs or the Castrati, for example, who were actually castrated to maintain their angelic singing voices, they have no hair loss progression, coincidentally, despite going into adulthood as like male. They have no hair loss because they have no testosterone, and subsequent to that DHT, or minimal trace amounts being produced from their adrenals, because their testicles no longer function in order to make those hormones. So they maintain the feminine, angelic singing voice, as they don't go through that masculinizing period in adolescence. So, but in addition to that, they don't get the hair loss that accompanies it. Now, obviously, the answer is not castrate yourself in teenagehood to avoid hair loss. But what does work is manipulating the hormone DHT after you have fully matured. That, unfortunately, is the primary way you prevent hair loss, is manipulating this sex hormone axis to a certain extent, where you can leave the anabolic muscle building component intact with testosterone unaffected. But DHT, the degree to which you inhibit it, essentially determines how much prevention capacity you have relative to your genetic predispositions. So if you take a guy and you nuke his DHT, despite having testosterone, he will likely, unless extremely prone, have a cessation of hair loss, or at least drag it out for a much, much longer period of time. There's hordes of literature that reinforce this. It's almost beyond question at this point that this is the primary thing that determines hair loss, all but, even if it's indirectly, the primary root of the issue, unfortunately, is DHT. So manipulating that is not side effect free in every single individual, and assessing if you are that person who might otherwise encounter side effects or gynecomastia development or erectile dysfunction. Like, there are certain things that you could kind of flesh out the probability to some degree via a panel that is designed around this assessment of your exact health status right now before therapy, as to if you're a good candidate. Because some people do encounter lowered libido, erectile dysfunction, depression. Like, this is not impossible to happen, all but I do think ultimately getting a sense of where you stand on your ratio of androgens to estrogens, binding proteins in the body, and a lot of the same stuff we do test with our other panels, but with a greater emphasis on the hormones that dictate free androgenic signaling, in particular DHT action through total DHT, free DHT levels, getting a sense of where you stand in your propensity to develop, breast tissue as a male is of a greater emphasis, and to assess that you don't have any neurosteroid deficits prior to starting therapy, because there is also impairment of the synthesis of certain calming, anxiety reducing neurosteroids that may otherwise be somewhat inhibited, all but not clearly in the literature, but may be inhibited to some degree by the implementation of something like finasteride. So assessing where you stand on the spectrum of, are you a low producer at baseline and then you're pushing yourself into a state of deficiency with this therapy introduction? Are you somebody that has borderline low T to begin with, and when you drop your DHT and now you're relying almost entirely on the minimal testosterone you had to begin with to support all androgen induced functions in the body? These are all things that could be used as factors to determine how good of a candidate are you, not just for the efficacy of the treatment, but also the propensity for side effects. Certain individuals, if you have enough testosterone working in your body to offset the decrease in DHT, at some level you will have enough testosterone to offset the androgenic input that otherwise was facilitated through DHT, even if you deprived it entirely. But depending on the person, that level may exceed your natural capacity for what you need specifically. Or you might have a disproportionate amount of estrogen relative to your androgen input, or high SHBG. When you decrease your DHT, this becomes an unfavorable balance of androgen to estrogen. That's where the gynecomastia and erectile problems come in, or depression, or lack of motivation and drive. The masculine traits that you otherwise associate with male hormones can be diminished to some extent if you're not in a favorable baseline state to implement these therapies and be one of the individuals who gets away scot-free, more or less seemingly, with minimal or imperceivable entirely, aka zero side effects and the full benefits of the treatment. You want to know full blown, before you get into it, what is my likelihood of this happening? You can't say with certainty, even with the blood work, but it's better than nothing in my opinion.
If someone's in their 20s or 25 years old, hair is important to them. They want to hold on to it as long as they can. You already mentioned you're prone to what you're prone to. You're going to lose it eventually. It just kind of depends on basically just when it's going to happen. When would you recommend someone actually getting, testing, looking at their levels to see when it's appropriate time to jump in to explore these options?
I would say after fully going through puberty, if you are very prone to hair loss, that is probably the earliest time I would recommend looking at it, because it's tough, man, because it's even when you look at the side effect potential, does it outweigh the mental burden that it has for some people from a cosmetic perspective? Some people actually do not even want to leave the house because their hair loss is bothering them that much. And, some people might say, just shave it, bro, be confident. Jason Statham, he's great. The Rock, Bruce Willis, the standard examples that everyone thinks of. And that works for some people.
Sure.
Some people it doesn't work so well. So, to tell that guy he just needs to be happy with being bald because you are, don't impose that on him. That's his decision at the end of the day. And similarly, guys with hair who prevent hair loss shouldn't be imposing their decisions on people who are trying to decide if they want to use drugs or not. Anyways, as far as the earliest age, I would say once you're done puberty, that's kind of the earliest I would look at it seriously. I don't even know for sure that you would be inhibiting your growth capacity should you have intervened mid-puberty, but I certainly wouldn't want to. That is a situation where I would say, okay, you're probably maybe let some hair go to ensure that you're getting the full effects of your DHT when you need it to achieve full maturation, masculinization of the things you need to be masculinized. You don't want to end up with a higher voice or a smaller penis because you started finasteride a bit earlier. Not that I know it would, but I mean, who wants to chance that? So to be clear, hair loss is going to affect almost everyone listening to this that's a male, almost everyone on the planet, essentially, unless you have extremely resistant genetic predispositions that most people aren't fortunate enough to have. It's just the truth of the matter. And with normal DHT levels, you will still have hair loss. It happens all the time. It's you don't even need to point to the literature to show the examples. They're walking around you every single day. The thing that sucks about hair loss, more or less the actual scalp infrastructure has a permanency of deterioration once you let it get to a certain point. So after hair follicles are miniaturized, these are literal organs on your head. And after they get to a certain point, you can only make up so much ground once you actually become aware of this and take it seriously. Proactive approach is the way to go. You don't wait until you're basically bald to then take it seriously, because at that point, even if you did the full-blown protocol, you probably need way more intensive of a drug protocol just to get back to what is otherwise a suboptimal level of hair still than you would have if you just took like a very benign, low dose, entry level approach to hair loss prevention from day one and took it seriously. It's tough because it's an area that ultimately is essentially unresponsive to lifestyle and diet, but it's also hard to tell somebody like proactively, like just get on drugs, bro. But like when it comes to hair loss, if you care enough about it and you're predisposed to it, which most are, you almost don't have any choice other than if you want to go the cosmetic route where you just get like transplants every time you want to gain back ground. You use like, I don't know, masking techniques to like make it look thicker. You get a wig, like, I don't know, like whatever you want to do with that. That's the thing that's tough because shedding does not equal permanent loss. Like I'm sure you could speak to, or maybe you couldn't, I don't know, some girls are different, but like girls often shed like dogs, but they don't.
Yeah,
their hair grows back just
wife's
fine.
hair is everywhere.
Yeah, it's like, now obviously it's longer, so it takes up more space. But I mean, in general, shedding does not equate to you lose your hair. Like if that was the case, you know, dogs would be bald too, maybe. Like, you know, just, it's not even that relevant. Like it is something that can be used as an indicator of something is triggering accelerated shedding, which is something to maybe take note of. But like, you know, you're supposed to lose 100 hairs out of your head per day as a natural rate of shedding. Seasonally, sometimes that accelerates to a higher amount depending on where you are in your hair life cycle. And in general though, the thing that is actually happening that is resulting in the hair loss is not necessarily more or less hairs falling out. It's more that the quality of it and the duration and the quality of the actual growth phase is diminishing more and more over time. So every time the hair follicle grows back, it's miniaturized, and it's a result of all the downstream consequences of free androgenic signaling in the scalp. Every time it grows back, it's weaker and thinner and thinner and thinner. And then over time, eventually it's essentially non-existent when it's coming back and like dead. And that area, that actual organ, is actually damaged to a point of potentially being no longer salvageable. So getting in front of it before it becomes essentially a dead organ is kind of the only way to do it. Ultimately, if you want to maintain high quality hair and you are otherwise prone.
What are some of the treatment options that are even available, and what are the differences?
So the things most people are familiar with, and probably the main things worth talking about without getting into the hyper nuanced, either research chemical territory or things that are in the pipeline to be developed but don't yet like technically exist in like the actual marketplace. I would probably say the main things to look at are that you could get an over-the-counter like anti-androgenic shampoo, which, you know, like a ketoconazole shampoo, for example. Again, very, very mild, not going to be the needle mover in a protocol, but it's over-the-counter, essentially side effect free, and everyone uses shampoo anyway, so you might as well get one that does something. That's something that has like some evidence for some level of impact, all but not going to protect most people entirely. But for some people with like very minimal propensity, they might be able to offset it with just that, but unlikely. The things that really move the needle are, of the over-the-counter treatments, Minoxidil, which is the only growth stimulant that's FDA approved that actually really hits hard and works. And while it grows hair, it doesn't actually prevent androgenic alopecia from continuing. That DHT is still wreaking havoc on your scalp, regardless of the fact that you're stimulating growth. The stimulation of growth is only offsetting the cosmetic representation of loss via the new hair or the prolonged growth phase of increasingly healthy hair that's being supported by minoxidil, but you're not preventing the further miniaturizing of hair follicles from androgens, DHT. So you might think you're preventing loss with minoxidil only, you're not. The analogy I like to give in my content on YouTube is you're in a canoe trying to row against a current, essentially. There's a stream and you're trying to row against the current, and minoxidil is you trying to like row forward, working against the current, which is DHT. And what you want to do is ideally get the current to stop raging against you and go to just calm. And then you can row up the current and actually make ground back. So you need to stop the further loss, ideally through the androgen manipulation, if you want to go that route, should it be warranted and you are willing to take on the risks, you know, and the side effect burden potential. But actually getting regrowth is facilitated through the minoxidil. And if warranted, if you're a non-responder, there are other strategies that can be implemented to convert you to a responder. And that's where, you know, the nuance of interpreting this stuff through a company like Marek Health, if you are a non-responder, like what do? Are you just screwed? No, like there's things you can do like microneedling I've talked about at length on my channel. But in addition, something that I've talked about, all but not as elaborately, is tretinoin compounded with minoxidil to enhance something called sulfotransferase enzyme activity, which is the enzyme that converts minoxidil to the active minoxidil sulfate. Some people with low enzyme activity on their scalp don't actually get the adequate conversion to the compound that imparts the effect you're seeking from a growth stimulation standpoint. So getting a compounded product through a pharmacy that is able to make a minoxidil plus tretinoin formulation could convert somebody to a responder that otherwise didn't, even with the minoxidil plus the microneedling. So there are things that can be done. It just needs the nuanced interpretation and educated assessment of like, what are the most progressive treatments and what does this person need? And then from actually stopping hair loss, that's where you get into the inhibition of DHT primarily. And that's Finasteride is the main go-to therapy for that. And it's tried and true, it works incredibly well. And there is some risk of side effects, but that is where having a very candid conversation with your medical provider, if it's right for you, and what the real risks are, because the data is, I think, pretty clear as to what your probability is of risk, the likelihood of if you have a side effect, if it's going to go away, how long it will take. Like these are all things pretty clearly elucidated in the literature that in general represent what a fair probability is of all of each scenario, probability of each thing occurring, whether you're going to have benefits with no side effects, benefits plus side effects, no response plus side effects, and then you come off of it, how long it takes to restore. Like all that stuff is very clearly elucidated in the literature. And there are fringe examples of people who have outlier responses, but just like any drug, there are very extreme responses to some drugs. And that's just part of what comes with the territory with some of these, with pharmacology, unfortunately. But ultimately, like for me personally, I use Dutasteride, which is the nuclear version of Finasteride essentially. And I know for sure I would be very bald right now had I not implemented it years ago. So, for me, it was worthwhile. Obviously it could change over time, who knows? But at least to me, I have not noticed any side effects to date. And it's been a net positive in my life. Now, obviously that could differ for certain individuals, and that's where talking to somebody candidly about the viability of it, and if you're a good candidate, is worthwhile and a important conversation to have with somebody who knows what they're talking about. Marek Health is exceptional in their knowledge when it comes to hair loss prevention and the assessment of who's a good candidate versus not, and what therapies would be worth actually pursuing versus not. So when it comes to the most efficacious treatments in general, on the pharmaceutical side, it's going to start with Finasteride. And then if you need to increase the intensity of DHT reduction to actually get a even greater effect, or you're not responding to Finasteride after 6 to 12 months, that's where Dutasteride might be worthwhile. And there are new emerging technologies when it comes to anti-androgen therapy topically and androgen receptor degraders that we could speak to, but I think it's probably outside the scope of this conversation, where the main things that hit the heaviest and have the most data to back their efficacy and safety profiles: Finasteride, Dutasteride on the DHT manipulation side, and on the hair stimulation growth side, minoxidil, microneedling, tretinoin to enhance the capacity of minoxidil to convert to minoxidil sulfate, and over-the-counter shampoo, basic stuff like ketoconazole, whatnot. That's kind of the bread and butter of most protocols.
And with the minoxidil, that's a topical, and then Dutasteride and Finasteride, or a tablet, a capsule.
Yeah, so when it comes to minoxidil, there is more awareness being brought around oral minoxidil, which existed as like an outdated, really terrible antihypertensive drug, which was repurposed for hair growth topically when they found that people were growing hair everywhere, essentially, when they took it orally for blood pressure lowering. And while it works maybe better orally to some degree, it seems like the likelihood of side effects is higher by a fair degree. In addition, the level of efficacy that it has over topical is mixed in terms of if you're likely to get a significant upside on using it over topical. I think a lot of people are quick to jump to oral because they think it's going to be dramatically better, but they have not yet tried actually ensuring their scalp environment is actually healthy, that they're absorbing it properly, haven't tried microneedling, haven't tried the tretinoin, etc. Once you've tried all those things, it might be worth considering, but it has a black box warning on the drug, and it is what appears to be a higher side effect profile, or a far more risky side effect profile than topical minoxidil, which has hordes of literature supporting its safety and efficacy concurrently with very, very impressive before and after results. especially when coupled with the other adjuncts that I mentioned. But as far as the pharmaceutical side, finasteride and dutasteride can be used topically, all but it seems like oral is the best for achieving not just adherence, because it's at least easier to adhere to taking a little pill every day than applying something to your head, but the upside you get from localized activity and like lack of systemic activity that people purport from finasteride doesn't actually play out in practical application. It seems like you still get the same systemic DHT reductions, just with the annoyance of having to apply it to your head. So I don't know if it's worth using either topically. I think oftentimes it is assumed that it's going to be safer, similar to the topical minoxidil, but there's no data to support that really. When you look at the actual breakdown of systemic levels, you know, the finasteride will suppress your DHT just as much ultimately once it absorbs in a similar manner. And topical dutasteride, you know, there's some interesting literature on mesotherapy of it and injection into the scalp with it and things of this nature. But in general, oral seems to be the go-to for most people when it comes to 5-alpha reductase inhibition through finasteride, dutasteride.
So people should start off by getting the comprehensive hair panel that covers all of the hormones. And
although I certainly wouldn't say it's a mandatory necessity, because some people are on a budget, they don't want to get elaborate blood work, they just want to jump on therapy. They also don't want to wait, because you know, it's not like you're going to lose your scalp while you're waiting for your blood work results. But I mean, some people don't want to coordinate the LabCorp appointment, wait a couple of weeks, you know, and I would understand if they just wanted to, you know, I'm pretty confident I'm going to be fine, I'm not too worried about the side effects, let me just get on therapy. Those individuals, that's their choice at the end of the day. But in general, if you were somebody who's kind of on the fence, I would say it's probably worth doing, because if you cared that much about your health anyways and the potential side effects, you probably would benefit from a baseline panel for your actual seeing what's under the hood regardless, let alone your propensity to side effects from hair loss prevention medication. So seeing where you stand systemically as a whole, I think is worthwhile, but then getting that additional assurance that either I am a good or a bad candidate could help you guide your decision, make you feel a bit more comfortable with the process and even know where you stand. If you want to get a panel or get assessed by a medical provider who understands all of the intricacies of what we just discussed, check out marekhealth.com, and we have other content as well if you want to check it out on our social media platforms or the More Plates, More Dates YouTube channel. If you want to sort the playlist by hair loss prevention, you can check that out as well. So thanks for your time, man.
Awesome. Thank you.